Okay.
Okay, so this is Dr. Pierce. I'm a kidney doctor, and I'm seeing Ms. Anderson, and I'm going to explain a little bit about what my impression and what I would suggest is the plan. Ms. Anderson came in with several days of nausea and vomiting, quite severe, inability to tolerate food and water. And she was sent to the hospital because not only did she have these symptoms, which would normally be expected to resolve on their own, but she also has had what seems to be quite severe kidney failure. The kidney failure, there's no evidence that it's been going on for a long period of time. She did not have symptoms prior to coming into the hospital or prior to a few days before coming into the hospital. But I don't know the origin of the kidney failure, and it's not improved with IV fluids as would be expected with dehydration. So what I'm proposing to do as a possibility to find out what is wrong with Miss Anderson and to find out what treatment she should have is to consider a kidney biopsy. I would also consider dialysis to clean the blood prior to the biopsy to make the biopsy safer and to relieve some of the symptoms of nausea that she has, which may be from the kidney failure. The biopsy would give us most likely diagnostic information, what's wrong with the kidneys, and would help us know what to do next to try to fix the problem. Ms. Anderson has asked me if I think that this is a condition that from which she won't recover, and I actually think that there's a good chance she will recover, but we have to know what it is.
It keeps going. Okay. It keeps going. Just touch it. Oh, I hope it recorded.
I think that's
Oh, I'm nervous.
okay. You can leave it at this, right? So what I'm proposing to do is some temporary dialysis. What dialysis is that it is a procedure which does not cure the kidneys, but is able to clean the blood, which will help Miss Anderson feel better, and also help her blood clot a little better. The way dialysis is done is we have to take the blood out of the body, clean it in a machine, and return it to the patient. The way we do this is we use a very large IV, which looks a little bit like a small straw, and it goes into a big vein in the neck. And what this does is it allows us a way to take the blood out, clean it in the machine, and return it to the patient. The procedure takes place over a course of a couple hours, and the dialysis catheter, which is the little straw I mentioned, is put in by the radiologist, and that takes about 10 minutes. It's a local anesthesia procedure. So I think that this would be the safest way to proceed, to go ahead and start Ms. Anderson on dialysis and plan for a session today and a session tomorrow. I would also plan a kidney biopsy for tomorrow. That way we may have the results by Friday, at least the preliminary results. The kidney biopsy purpose is to figure out what's wrong with Ms. Anderson's kidneys. So I don't know that there's any other real efficient way to find out. The other option would be to send off lots of labs and to do waiting for the next 3 to 4 days at least. And I don't want to take the chance that we'll go into next week with no change, because I haven't seen a change so far.
Now there's one more.
Okay, there's one more, and we're getting that recording. And between the second minute and the third minute, it's really low, but nothing was being said. They were just messing with the recording.
It's gone. It won't go back.
Okay. I'm going to pause it.